Hello again, welcome back. This is Bread and Butter Primary Care. I'm Dr. Stokes, and today we're going to be starting on our mental health unit. And so today's talk is entitled, What is Depression and Why Do We Care? And so we're going to talk about how you define depression medically as far as diagnostically, a little bit about the potential causes and where it comes from and why it's important. Okay, so let's get to it. Diagnosing depression. What is depression? So medically speaking, according to like the DSM criteria for mental health diagnoses, depression is when a person has 5 symptoms out of a set of 9 for at least more than 2 weeks. If they've had them for 2 weeks, it's a major depressive episode. And if it's long term, then major depressive disorder, if it's more of a permanent state of being. So there's 9 things that are symptoms of depression, and you need to have 5 of them for more than 2 weeks. And the 9 things are things like depression, so feeling depressed, down, low, sad, trouble sleeping, or second one usually is anhedonia, which is not enjoying things you used to enjoy. Trouble sleeping, either too much or too little sleep. Trouble eating, either too much or too little eating. Fatigue, feeling like you're just tired and worn out and don't have any energy. Irritability, so feeling like you're restless and agitated and moving faster than what you should, or the opposite, feeling like you're slow and almost like you're kind of running in slow motion. And then suicidality would be the final one. And so those are the 9 cardinal symptoms that people can have, and then you need to have 5 of them. Now, usually this is done via something like the PHQ-9, which is a health questionnaire that patients can follow out. It takes those 9 symptoms, and it just asks them about them. So it says, in the last 2 weeks, how often do you have the following? Feeling down, depressed, and hopeless. And then they say, feeling like you don't enjoy the things you usually enjoy. Feeling like you're tired and don't have any energy. Sleeping too much or too little. Eating too much or too little. You feel like you're running as faster than normal, or the opposite, feel like you're running slower than normal. Feeling hopeless, worthless, like you have no value, and you ever have thoughts of harming yourself. And so there's those 9 questions, and they can rate themselves how often they happen, and then you can get a sense of where they're at. And so remember, those 9 symptoms, 5 of them for more than 2 weeks, and that is the technical diagnosis of major depressive disorder. So that's what it is. Where does it come from? What causes this? And this is what I really want to focus on today's video. I know that there's a lot of talk about mental health in kind of the social community right now. And so with the Olympics and the things that have gone on with some of the Olympians, I know that it's a conversation that we're having, and I think it's a good conversation. And so I'm going to go briefly about how I talk about depression with my patients and explain to them where it comes from, what causes it. Now, before I start this, I will give a little caveat here that it's much more complicated than this, and I understand that. It has to do with, there's neurohormonal things, there's things on the cellular level, there's psychosocial components, there's literally like 8 or 9 things that all contribute to this. To people having these symptoms for extended periods of time. And so I understand that it's more complicated than the example I'm about to give, but I think viewing it this way is a powerful way to view depression and other mental health disorders. It's accurate, although not entirely complete. And it also deals a lot with how we treat it as well. And so when I talk to my patients about depression and we talk about what causes it and where it comes from, I always compare it to diabetes. And so I say diabetes is a condition where you have an organ of the body that's not making enough hormone, which means you're not functioning like you should. So the pancreas doesn't make insulin, you can't get your sugar controlled, that's diabetes. Organ, not enough hormone, disease. Depression is very similar. The only difference is the organ is the brain and the hormone is serotonin. Now, like I said, it's more complicated than that. There's multiple hormones involved. There's things that are not hormonal involved. But You have an organ of the body, the brain, that's not making enough of a certain hormone, serotonin, which controls and affects the way you feel. And we know that increasing serotonin, as well as these other hormones, make people feel better, and decreasing these hormones makes people feel worse. Now, no one goes around saying that the diabetics should just get their pancreas to work better, right? No one says that. No one expects that. There's an understanding that, hey, if you have an organ that's not functioning, sometimes it's necessary to take medications to replace that. The thyroid's the same way. You have a thyroid. If it's not working, you take thyroid medicine to keep your body functioning the way it should. And that's a change in medicine viewing depression in that model, that kind of physical diagnosis model. And I think it's a positive change. And it aligns with the evidence. The more we study this, the more we look at this, the truer we see that this is the case. Now, it is also true that lifestyle and social factors, psychosocial things, play into it. And interestingly enough, not only do they play into how you feel, but one of the reasons psychosocial things change how you feel is also because of serotonin levels. And that's one of the things that I've learned recently that I just find to be completely fascinating, is that people who are having more success in life, at least to their own perspective, they perceive themselves as succeeding, have higher serotonin levels than people who perceive themselves as not succeeding. And so you can say, well, if they would just live their life and exercise and eat right and get their kind of life together and get rid of their toxic relationships, they'd probably be fine. That might be true, but it might be true because doing those things actually increases their serotonin levels. And so, like I said, it's a complicated thing. And it's also the case, with back to our example of diabetes, that a diabetic person can oftentimes, especially with type 2 diabetes, they can treat and they can improve and even get rid of their diabetes with the right lifestyle things. And so we all live on this spectrum as far as depression is concerned, where I look at it as there are individuals who, despite having all the psychosocial things in line, they have a good job, they have a stable family, they have friends, they have support groups, they're not in need financially, everything's controlled. There are people who, despite having everything in line and in order, still have low serotonin levels and can be improved with depression medications. There are people who the reason their serotonin levels are down is because they don't have a job and because they just lost a loved one, or they just went through a divorce, or they just lost a job, or whatever the case may be. And so fixing those things could be enough to get them where they're no longer experiencing the symptoms. But that doesn't make it any less real or any less important than the person who might need medication to help. And so I just think it's helpful for people to view their mood disorders, to view depression in terms of organ, not enough hormone, therefore I don't feel good. And there's multiple ways to increase that hormone. Medications can do it, counseling can do it, succeeding, getting rid of toxic relationships, whatever it may be, all those things can fix the problem. There are some people who, despite fixing all the psychosocial things, still need medication, and that doesn't mean that they're not doing enough. It doesn't mean that they've failed. It doesn't mean that somehow there's a failing inside of them. Just like there are diabetics who, despite having a healthy diet and losing weight, still need to take their medication. There are other diabetics who lose weight and exercise and they don't need to take their medication. It's not fair, but it's not fault of a person. There really is that component of organ function that plays into this diagnosis and into this condition. So that's how you define it. As far as diagnosing it, that's a little bit about where it comes from. Like I said, it's much more complicated than that, but I think it's a good way to view it. And we'll talk more about this as we get into treatment, because the treatment of depression, as far as medications are concerned, is mostly focused on increasing hormones like serotonin and norepinephrine and those types of things. Why is it important? Depression is the leading cause of disability in the United States. Something on the order of 16 million people are suffering from this. It's something like 6% of the population. And then there's suicide. So the morbidity and the mortality that comes from this condition are very high. They're very significant. And there's oftentimes a lack of treatment simply because there's a sense that it's only the psychosocial. If I only had my stuff together, this wouldn't be happening to me. Well, that may not be true. It can be just as much a medical condition as diabetes or low thyroid or high blood pressure. And so I hope that's helpful just to get things started, how you diagnose this, what the general cause of it is, why it's important. We'll be talking a lot more about different components of it, treating it in further videos, but I hope that's helpful, and I hope you have a great night.